AI has come up with a big bang. That's one thing, but it is also like a double-edged sword. You know, part of the academia thinks it's a boon, because we have seen it can ease out on our work. It can help us do our things faster, more efficiently, and prioritize where you know, we can escape from the daily routines and concentrate more on where the expertise is really required. I, from the laboratory, just citing one example, you know, with the equipments in, like, we are doing potassium estimation. So the present day equipments will only tell you that when the sample is put in, that the potassium is high for this particular patient sample. However, it will not tell you why. So when it is integrated to AI, it will tell you whether it is because of hemolysis, whether it is due to contamination, or if it has access to the history of the patient, can also give you a correlation to the history, whether it is relating to the history. So that's a boon. Having said this, it can be a bane as well. So a part of academia also believes that it can be troublesome, especially since it's a new thing. We don't have really too stringent guidelines in place. Rather, we don't have many guidelines. And especially looking at you know, countries like us, where we tend to follow others. So once we started using ChatGPT, Google, so you know, the patients would simply look at, go to Google search, put up their symptoms, come up with medications, start self-treating themselves, and there are cases being reported where they have ended up into harming themselves, maybe even costing their lives. So yes, it has its limitations as well. So I would put that in perspective, in the sense that whether it's a blessing or a curse, it depends on how we are using it. So with that background, I would start my presentation. In that, I would be touching on introduction to AI, what AI has a role in the laboratory, what are the pros and cons, and end of it I would summarize. So first of all, the history, we have to know where the whole thing started. So if we actually look at references of AI, it has dated back to ancient times, wherein there are references and myths and folklores where people have mentioned of some artificial objects which are related to you know, similar, showing similar results as to human intelligence. However, it was only in the 50s where Alan Turing, he first gave the Turing test, wherein he provided a method to study, to prove that you know, machines can have intelligence also. They can show intelligent behavior. So what he did was, basically he was giving same kind of questionnaires to a person and the machine, and then the results were being compared. So he was able to demonstrate that the machines can show intelligence similar to that of humans. However, it was only in 1956 that the first time artificial intelligence word was coined. That was coined by John McCarthy and his colleagues, and from there on the journey started. There were times known as the first and the second winters, wherein it was on its, the work on AI was on its low, majorly because of probably the you know, the investment, because it requires a lot of investment into it, and people didn't have much understanding as to you know, what to do with it. So since then it has picked up and never looked back. So we have, today we have reached a stage where we have you know, Tesla has self-driven cars, and we have ended up having superhumans. So much of information, what to do with it. So first, an understanding of what is AI. So artificial intelligence, it refers to computer systems that are designed to perform tasks that are typically requiring human intelligence, such as learning, problem solving, and decision making, I'm sorry. So artificial intelligence, artificial and intelligence. So we have created intelligence artificially put together, and that's known as artificial intelligence. So intelligence means the capacity to learn and solve problems, and when it is simulated, so that becomes artificial intelligence. So artificial intelligence is the simulation of human intelligence by machines, the ability to solve problems, act rationally like humans do. So are we suggesting that AI is just another software? Well, the answer is no. So what is the difference between artificial intelligence and the traditional softwares which already exist in place? So if we go by definition, AI, it can learn and adapt. So it's pretty dynamic. Whereas the traditional softwares, they follow the fixed rules. As regards to AI, learning, it improves over time. Whereas in traditional softwares, they need manual updates, like we have on our phones every time they are requiring updates, whereas that doesn't happen when you're using AI. Decision making, for decision making, it can think and predict, whereas traditional softwares do what they are already told to do. The AI can adapt to new data, so as and when new data is coming, it is getting intelligent and it is able to use that data, translate it into, every time it's growing, it's updating by itself. Whereas in traditional softwares, it stays the same unless it is updated. Examples are ChatGPT, which most of us are using, ChatGPT, Siri, etc. Whereas in traditional softwares like Excel and web browsers. So now type of artificial intelligence, it is broadly divided into capability based and functionality based. So capability based are further divided into narrow or weaker AI. So basically how much close or how much higher in terms of intelligence it is, that gives its name. So narrow or weak AI is better than human intelligence, but not that good. Whereas general and strong AI is better than the human intelligence for sure, but it has its own limitations. Whereas super AI is meant for superhumans, so they are far more better than human intelligence. Coming to the functionality based types of AI, could be reactive machines wherein it does not store much data, it doesn't understand, so the reaction is very quick, within seconds it gives you the information. Limited memory AI, it can give you certain understanding and can store data to some extent. Theory of mind AI goes a little step further. It can give you an understanding and it can upgrade the results and provide you the data. Whereas self-aware is a newer inclusion, it is a futuristic approach where in the self-awareness component has also been incorporated, still under study. Just two slides on machine learning. So what we are looking at is, we have data now. So we want somebody else to process that data for us. So that's what machine is doing it for us. It's learning and processing that data. So that would include learning, improving on that, bringing in algorithms, data mining, then analyzing that data, classifying as to which kind of data are we getting and how the algorithms are to be developed, and finally creating those neural networks. Those neural networks are used for deep learning. So just a few newer terms we have come across. Artificial intelligence is a broader spectrum which covers the general terms for machines capable of perception, logic and learning. When they are using algorithms to learn from the data to make predictions and decisions, then it becomes machine learning, and the performance will increase when the data input is increasing. So essentially it is depending on the data input. Like in laboratories we say, we work on GIGO principle, garbage in, garbage out. So whatever, how much ever good the data is, the results would be good, irrespective of course you have to maintain the laboratories. In the flip side, if I say, how much ever the laboratory is good, if the data, if the input is not good, if the sampling is not good, how much ever we do, we will not be able to produce good results. So machine learning essentially would also depend on the data which is being provided to it for its learning. And deep learning, it develops those algorithms. So it uses multi-layered neural networks to build algorithms to find the best ways to perform the work. So this would involve inputs, then multi-layered areas wherein deep learning is happening, there are neural networks, and finally the output. With this, I will come to the area I am from. I'm a biochemist, so I'm essentially concerned with the laboratory services, and that is the topic for discussion today. So in the laboratory, we divide the functioning of the laboratory into 3 phases, rather 5 I would say: pre-analytical, analytical, post-analytical, and post-analytical. Now if you're looking at the broader terms, pre-analytical, analytical, and the post-analytical phase. Most of the errors which happen in the laboratory are in the pre-analytical phase. That pre-analytical phase would include, would include actually preparing the patient for the said test, selecting the right kind of test, and then doing the test. I mean, in the sense, taking the sample, transporting it to the laboratory. Once it is taken up by the laboratory, then the analytical phase starts. So before that, it is the pre-analytical phase. Then once the laboratory takes the sample, it sends it for processing. Once the processing is done, the results are there, it is the analytical phase. What happens to the result thereafter is the post-analytical phase. So post-analytical phase would include whether if you have done some dilutions, there are some calculations involved, whether they were done or not, whether the physician did took the history of the patient in perspective, whether the interpretations were done right, whether the TATs were followed for that part, whether timely, if there were alerts, they were informed to the concerned physician or the patient, since they are the major stakeholders here. And time. So that would become the part of the post-analytical phase. Now looking at the functioning of the laboratory, we can very well appreciate that 62 to 76% of the errors happen in the pre-analytical phase. Around 6 to 15% of the errors happen in the analytical phase, and 18 to 30% of the errors in the post-analytical phase. Not that there are the number of errors are less, or the work is less in the analytical phase. It's only because the number of errors are less because maximum automation has happened in the analytical phase. So pre-analytical phase essentially lacks automation, and that is why there is room for higher percentage of error happening. Now this is where AI can help. If we can automate those areas, target them, target our felt needs, address them, and use AI, we can probably reduce the error rates in total of the laboratory services, besides providing timely results to the patients. So I would just go one by one as to what would be the concerns and what can AI offer. So coming to the pre-analytical phase, the problem is physician would order the test, samples are taken by the nurses and the interns. The samples, concern is whether the samples are taken at the right time, the right way. It should have been. So how to check that? Because like for example, I don't know if you have faced those problems in your workplaces, but we do. The samples, it becomes an emergency if you forget to send the lipid profile early in the morning. So by afternoon, it becomes an emergency, though it would not be. So who decides? If the patient is supposed to be fasting, whether we have ensured that the patient, how are we going to ensure that the patient is fasting or not? The common answers will be, bhool gaye. So bhool gaye, can AI help us in that? So AI can suggest what test is to be ordered. As I said, the pre-analytical phase also includes these type of test selection. So the AI can suggest what test is to be ordered based on the history of the patient, when and how it is to be taken for every patient. That means we would move a step towards personalized treatment of the patients, and that can be achieved by setting up reminders. Okay. Next, emergency samples, they are missed many times, and though they are to be run on priority. So I don't know if there would be people from diagnostics who would be aware of the fact that nowadays the automated equipments, they do have stat channels in them. So gone are the days when you used to have stat labs separately. We have, though we don't have at AIIMS Bathinda, but I have worked with pneumatic chutes. So the time of transport is decreased, and there are stat channels, so you don't need to have stat laboratories separately. The samples anywhere in the facility can reach your central laboratory within less than 2 minutes. So then once they are separate, we segregate the samples generally in the laboratories. That is, the procedure is essentially manual, which is an elaborate one. Again, time taking, so we are defeating the very purpose of calling a sample an emergency sample. So what classifies a sample as an emergency sample is also a big question, in the sense that, can we say that all samples coming from the emergency medicine department are all emergency samples? Or all the samples coming from the wards are routine samples? Difficult to say that. So if we are segregating based on from which department they are coming, at times we will end up missing a few very crucial samples. So again, here, can we look for solutions through AI? So AI, it understands the patient history and the type of the test, lab test. It determines it as an emergency. So it looks at the patient history and then decides whether it is an emergency or not. And then it auto scans and runs the test without any manual intervention being required. So saving on time and providing the test results to the patients, accurate results and in a timely fashion. Then another problem could be rejection of the samples. When the samples are hemolyzed, icteric or lipemic, or they have other interference presence, usually every laboratory has their own rejection and acceptance criteria. Once the samples are accepted from the pre-analytical phase into the analytical phase, that means into the laboratory, then it is mandatory for the laboratory to release the results. So to decide beforehand whether the sample integrity is in place, whether it is fulfilling your acceptance criteria, has to be ensured. So one of those things of concern would be the presence of hemolysis, icterus or lipemia or any other interference, if that is specifically interfering with the desired test analyte. So do all the samples with the interference need to be rejected? That's a big question, because if we don't do this, we end up pricking the patient again and again. So every laboratory maintains a record. There are SOPs in place wherein they will be telling, for this analyte, these are the interference. They can interfere with the results. That means the whatever false positives or higher values or lower values you are getting, they can be attributed to the process of doing the test and not because of the condition of the patient. So can AI help there? Yes. AI auto-learns and scans the samples to determine the type and amount of interference present in it. Hill index, that means hemolysis icterus and lipemic index, it is calculated. So basically, even now, the automated machines do have it. But what happens is, it takes the sample. If somebody is from diagnostics, they'll be able to appreciate that. The sample arrives then in the laboratory, the tests are run. What remains, a part of that is taken to assess the Hill index. That means you have already lost your resource. You have already lost your time. So, can we scan? We are not doing that before running the sample because it takes time. So, can AI pitch in here and help us with this? Based on that, it can run the sample and reject the sample. So, at the time when the patient has given the sample, he's waiting, he's around the collection center only. If he can just scan the samples and see that these are compromised samples, we can inform the patients well in advance if we really need to, and get the timely samples. Coming to the analytical phase. QC is the bread and butter of the laboratories, because we thrive on that way. All the confidence we get in the laboratories because we are maintaining our equipments and the system very stringently. So what is QC is the quality controls which are run in the laboratories, ensuring that, just as in simple words, we are ensuring that for a said analyte, if the value is 2, the equipment should be able to read 2. If it is reading 2, that means it is going to read the rest of the results of the patients also correctly. So all these things are, the QCs are run beforehand, before subjecting the patient samples to testing. Now this is a regular practice. Usually we follow an 8-hourly QC running. That means a set of QC, higher value set and a lower value set is run on 8-hourly basis, because it's believed that the equipments are able to maintain that QC levels or that standard for 8 hours. So to just give a coverage of the whole day, so probably it will be 8, and then in the evening, depending on the kind of workload you have. So can the shifts and the drifts be detected? So shifts and the drifts, or the trends, they are changes in the QC value which are slowly happening, because your reagent may have slowly getting deteriorated, maybe your equipment is depreciating. There are so many things which will slowly contribute to the changes in the values of the mean values of your QCs, which are good indicators. But then, when do you come to know? You would require at least 10 data points towards skewed to one side to say that it's a shift, a sudden change, or slowly it's happening, a drift, or it has crossed the mean, it's a trend. So that means it will require time. But can AI help us in that? Well, yes. So it can learn and create moving averages. So in real time, it is taking averages. The QCs are there on the equipment. As and when required, it picks up the QC, runs the QC, and sees whether it is in sync with the desired limits or not. If not, it will run, rectify, or maybe pop up depending on what kind of programs you have done, that whether you have to go for recalibration, change the reagent, or whatever the root cause could be. Then it can also ensure reliable results, suggest running of the QC at the right time. So it will be able to pick up those minor changes. What I'm trying to suggest is, since we are giving QC on 8-hourly basis, so what if we miss those changes within those 8 hours? So AI can help us detect those minor deviations and rectify them on time, because we are reporting samples of patients during that period as well. When the other problem could be, it takes a lot of time to troubleshoot issues, especially when they are happening with the machines, if you're doing it manually. This in turn can affect the turnaround time of a laboratory. Every laboratory, we are in the process of accreditation, but all those laboratories who are accredited, they are committed to a certain TAT, that's a turnaround time. They do say that I would come what may. If it is an emergency report, I will give it within 2 hours. If it is a routine report, I will give it within 6 hours. So that's your commitment, and you have to abide by that. Now, whenever there is a problem, you halt the testing, and there is every chance that you would cross your TAT time. So can AI help in that? While integrating AI, it compares the QC maintenance charts in real time. It troubleshoots in seconds. For us to look for all things, whether the calibrations went wrong, whether the reagents are wrong, whether something happened to the machine, whether the sample is not correct. So there's so many things we'll have to, and in each category we'll be looking for 5 to 10 reasons. So it takes time to see each one of them and rule out each one of those causes which can eventually lead to poor performance. But AI can do it in seconds, saving time. So it reduces the TAT, providing faster and more reliable results. Then the results of the test, once they are done, as I said, once they are done, they go to the physician for analysis. So at the time of reporting, then it will become a post-analytical phase. But if at that point of time, the physician feels, oh, I think we should have got this test done as well, then what do? We go back, ask for a repeat sample to the laboratory. So the question is a fresh sample required always? Well, there could be a solution through AI as well here. Since AI can understand the clinical history of the patient, compare it with the result, and do reflex testing. So it can give you a pop-up saying that, for this history of the patient, these are the tests already done, but I suggest, if you want, with the same sample, this another test can be done. And then in consultation with the same sample, the additional tests can be, the add-ons can be done, saving on extra pricks or discomfort to the patient. Then when it comes to understanding complex charts, reports, integrating them, as in case of mass spec reports or a chromatograph or FTIR reports wherein complex data has to be studied, there is every chance that we might end up making manual errors. So here again, we can take help of AI.
Monika, you're taking little time, or is there any issue?
So AI learns from the laboratory of the reports, integrate all patient data before preparing the results. So it gives faster results, more accurate and more reliable results. Management of inventory is a big thing, big issue, because especially for labs which are having large workload, managing the inventory is a Herculean task. So here too, we can sought help of AI. It can, look at your reagents or place the orders and maintain the availability chain of the reagents. In the post-analytical phase, the reports, it can prepare the reports in a very short time. In this era, we are looking for interpretation of the results. For consultants to do it for individual patients is very difficult, but AI can help us in that. So we can go more towards personalized medicine. Again, the same thing, personalized medicine, it will help in early diagnosis and treatment. We can personalize the testing and the results. So certain applications of AI, Twin, there are certain applications wherein AI is doing all that work for you. They are preparing your notes, they are guiding you to do the test. These are the places where cell culture labs are using that just to ensure lack of contamination, high accuracy and fast results. Last, there are advantages, but we have to be wary of the disadvantages as well. AI requires lot of cost investment. It can cost us jobs as well. It lacks creativity and emotional component. That's a limitation of AI. And the biggest limitation being the ethical concerns. Since we do not have ethical rules in place, especially black box phenomena, they are big concerns. So that have to be addressed before, taking up AI in a big way. So summarizing, last line, it's good as long as we know how judiciously it has to be used. So ultimately we have to, rest our clinical acumen as regards to using AI in healthcare. I would leave you with this quote. Artificial intelligence is good, but we should not lose on real intelligence. Thank you very much for your time.